After we discuss about the behavioral and humanistic approach used in guidance counseling, and now we will continue to discuss the other techniques and theories used in guidance counseling. These are the Adlerian therapy or individual psychology, reality therapy, the group therapy. And now, we will first discuss or tackle about the Adlerian therapy or also known as individual therapy. The most influential person in this therapy is Alfred Adler. Adlerian therapy, it is originated by Alfred Adler. In this therapy, it focused on the creating a therapeutic relationship, cooperative, encouraging, and practical. Adler was a major contributor to the development of the psychodynamic approach to therapy. Adler founded the Society for Individual Psychology in 1912. In these times, another person involved in this kind of therapeutic techniques in guidance counseling. He is Rudolf Dreikurs. He is the most significant figure in bringing Adlerian psychology into practice. He was given credit for the idea of child guidance centers and training professionals to work with a wide range of clients. Adlerian counselors help clients look at their lifestyle and personal values to help them understand and question their usual patterns of behavior and hidden goals. Adlerian therapy, it is a learning process that assists the client to move toward useful involvement and contribution to society. These are the following areas that we will discuss about the Adlerian therapy. These are the following areas that we will discuss about the Adlerian therapy. Basic philosophy of Adlerian therapy. Adlerian concept of social interest is the individual's feelings of being part of a whole, spanning the past, present, and the future. Also, people strive to become successful and overcome the areas that they perceive as inferior. So in this part, they will focus on the behavior or a situation that they think that they are less. So that is the part that we tend to improve themselves. Adlerian theory emphasizes personal responsibility for how the individual chooses to interpret and adjust to life's event or situations. Maladjustment is a choosing behavior resulting in a lack of social interest or personal growth. Okay? It happens to a person when he or she has a less interaction with the other people or being too much introvert. So these are the person that want to be themselves, want to be alone. Then theology, it is when a person influenced by future goals as by past experiences. Adler believed that the birth of each child changed the family substantially. It may influence many aspects of their personality development. So this is the times when there is changes of the relationship of the family member, especially when there are a lot of siblings. So if the children can understand their roles and responsibility, maybe there is something that develop, or there is something attitudes that may develop in their life or in their self. These are the characteristics of children's birth position. Okay? If we talk about oldest children, they tend to be high achievers, parent pleasers, conforming, and are well behaved. So because they are the role model of their siblings, of their young siblings. So mostly the responsibility are given to the oldest children. Next is the second born children. They tend to be more outgoing, less anxious, and less constrained by rules than firstborn. The third one is the middle-born children. Feeling of being squeezed in and are concerned with perceived unfair treatment. So this is the characteristics or situation that they may face. So maybe we can surely tell that it always in this situation. Okay, it may differ from what kind of family or family situation you are involved. The next one is the youngest child, most apt at blessing and entertaining the family. So as me, as an example, I am the youngest child or children or the youngest sibling in our family. So I could say that this statement is true to us, or it's true to me, because as being a youngest child, so you want your family or your family members to be happy. So you tend to do something that makes them feel happy and joy. Okay, the last one is the only children or born 7 or more years apart from siblings. Okay, they are more like firstborn children. Take on the characteristics of their parents' birth order. Okay, next is Adler believed that children's interpretation of the events in their life was determined by the interaction with family members before the age of 5. So, in this statement, we could say that we know that the foundation of knowledge, especially the best part of the children or of the child to be educated, and we should give them the best attitude, the correct and the rightful attitude that they must get or acquired. So that is the foundation. So it is good that at this stage we give them the best attitude or characteristics that they may have. Okay, the perceptions that guided the children's behavior were called fictions, and from these fictions, they may create a mistakes. And Adlerians believe that some of these mistakes are, according to Mozak 1984, are the overgeneralizing. It happens when individual believes that everything is the same or alike. So he or she think that everyone are the same. So the second one is the false or impossible goals of security. It happens when individuals try to please everyone in seeking security and avoiding danger. So maybe it happens when a person want to be safe. So he will not take a risk for herself or himself to be in a danger or to be in a problem or in a problematic situation. Okay, next is misperception of life and life's demands, which leads to expect more accommodation than is reasonable and to interpret their failure to get it as never getting any breaks. Next is minimization or denial of one's worth, believing that they can't be successful in life. So maybe we could say that this is one of the worst way of thinking, because we know that life full of challenges, and maybe we could experience a ups and downs, but it is important that every ups and down we gain lessons, or we tend to be more encouraged to do more, to do the best that we can do. Next is faulty values. It is a term of me first, a mentality with little or no regards for others. So it is full of self-love or self-worth or selfishness. So maybe this is a very bad mistake, because we could say, diba, na there is a saying that no man is an island. So we can't live on our own, because every day we socialize, we interact with other people. So we must not focus on our own. So we must consider their feelings, their way of thinking, and try to understand our differences. Next is life took courage or a willingness to take risks without knowing the outcomes. Okay, this is the one of the faulty or the mistakes that we discussed recently. So we know that life has or had a ups and downs in life. So even though we don't know what will happen next, but we are willing, we have courage to take that risk, no matter what will be the outcomes, as long as that we learned, that we gain from that kind of situation. Okay, in this individual therapy, a person with healthy lifestyle contributed to society, had meaningful work, and had intimate relationship with others. Key concepts of Adlerian therapy are the unity of personality, need to view people from their subjective perspective. So if we talk about subjective, more on feelings. So we must consider their feelings before saying or doing something to them. Next is importance of life goals to give direction to behavior. So it is important that we are directed with our goals in life. People are more or motivated by social interest and finding goals to give meaning in life. So in this area, so we can be motivated by having a intimate or a good relationship with the other people around us. The next is striving for significance and superiority, developing a unique lifestyle, understanding the family constellation, providing encouragement and assisting clients in changing their cognitive perspective. So if we talk about cognitive perspective, their way of thinking, their way of organizing their thoughts, the roles of the counselor in Adlerian therapy. They are a diagnostician, a teacher, and a model. They help the clients to explore conscious thoughts, beliefs, and logic for behaviors that are not in the client's best interest or social interest. They encourage the client to behave as if the client were who they wish to be. So they will help the clients to be someone that they want to be. So there is a person that they modeled. So a person that they want to become like them. They provide the client with homework, assignments outside the session. Yes, it's already used in different approaches because we know that there is a greater result if we continue the learning or the session after the therapy in the office. So it has a greater result when they continue what they learned from the therapy session to their home or to their workplace. The goals of therapy: to challenge clients' basic premises and life goals, to offer encouragement so individuals can develop socially useful goals, to develop the client's sense of belonging. So in this kind of therapy, we know that it focuses on individual. So they help the individual to be able to understand others and to be with others and to learn how to be with others. What are the therapeutic relationships? The emphasis is on joint responsibility, mutually determining goals, mutual trust and respect, and equality. A cooperative relationship is manifested by the therapeutic contract. So they also use a contract, so a writing agreement between the clients and the counselor. Focus is on identifying, exploring, and disclosing mistaken goals and faulty assumptions within the person's lifestyle. What are the possible techniques of therapy? Okay, during the session or the conduct of the therapeutic session, pays more attention to the subjective experiences of clients than in using techniques. So they will focus on the feelings or the story that the clients may tell to the counselor. So focus on their feelings of a certain behavior or a certain situation. More commonly used are establishing rapport, defining style of life, and helping the client to gain insight. So yes, we must develop the rapport within the counselor and the clients to develop, yes, trust and security. Confrontation, challenging the client's private logic and behavior. Asking the client how their life would be different if they were well. So maybe they will give the clients a kind of question that they want their life to be something other than their situation in their present times. So what they want to become in the future, so what are the kind of or a situation or a behavior that they want to remove or change for a betterment. Encouragement, supporting the client by stating the belief in the client's ability to take responsibility and change behavior. Acting as if. Instructing the clients to behave as if there were no problem or as the person that the clients would like to be. So, possible example, maybe they have done something that it is not good. So that is why they ask for someone to give or to guide them. So they join in the therapeutic session. So what if that's not the kind of choice that they made? So what kind of person they are now, or what kind of situation maybe they are into. Spitting in the client's soup, the counselor points out the purpose of the client's behavior. Catching oneself, helping the clients learn to bring destructive behavior into awareness and stop it. So yes, into awareness. So meaning maybe there are behavior kasi na denial sila. So tinutulungan na mas maintindihan ng client na, ito pala yung ginawa ko. Ginawa ko pala ito. So na merong reflection. Merong nangyayaring awareness na ito pala yung ginawa ko. So, ganyan. So, they are able to understand themselves and try or help them to stop this kind of behavior. Task setting, helping the client set short-term goals leading toward the attainment of long-term goals. So, there are tasks that they need to be done. Applications, it is based on a growth model and applicable to varied spheres of life as child guidance, parent-child counseling, marital and family therapy, individual counseling with all age groups, correctional and rehabilitation counseling, group counseling, substance abuse programs, and brief counseling. Also, it is suited to preventive care and elevating a broad range of conditions that interfere with growth. The multiculturalism of Adlerian therapy. It is focused on social interest, collectivism, pursuing meaning in life, importance of family, goal orientation, and belonging is congruent with many cultures. Focus on person in environment allows for cultural factors to be explored. Some clients may view the counselor as an authority who will provide answers to problems, which conflicts with the egalitarian or person-to-person spirit as a way to reduce social distance. Contributions of Adlerian therapy in the world of psychology or in a world of counseling. A key contribution is the influence that Adlerian concepts have or had on other systems and the integration of these concepts into various contemporary therapies. Other kind of therapy, it has also limitations. So the limitation of this Adlerian therapy, it has weak in terms of precision, testability, and empirical validity. Few attempts have been made to validate the basic concepts by scientific methods. Tends to oversimplify some complex human problems and is based heavily on common sense. So under perception, under subjective perception. Other theories and techniques used in guidance counseling is the reality therapy. It is introduced by Dr. William Glacier. It is based on a concept called choice theory, or originally called control theory. It was developed by William Glacier in 1960s. Glacier believes that people who are behaving in inappropriate ways do not need help to find a defense for their behavior, because they know, it is originally called choice theory, our freedom of choice. Instead, they need help to acknowledge their behavior as being inappropriate, and then to learn how to act in a more logical and productive manner. So, realization, it helps to realize your own mistakes, your own behavior, or your own negative behavior. So, it helps you realize. Then, it also helps you to change that behavior. Reality therapy attempts to help people control the world around them more effectively. Focuses on the here and now of the client and how to create a better future. It emphasizes making decisions and taking actions and control of one's own life. It focuses on facilitating the client to overcome aware of and, if necessary, change his or her thoughts and actions. Glacier believes that there is health or growth forces in every person that seeks both physical and psychological health or growth. Also, Glacier's identified two critical periods of development in children. It first happened in ages 2 to 5, first learn socialization and learn to deal with frustration and disappointment. Children not getting support and love from their parents during this critical time begin to establish a failure identity. So we know that 0 to 5 years of a child, it is a formative, the foundations of learning. So we must help the pupil develop the right character, attitude, or behavior. Okay, the next is ages between 5 and 10, or 5 to 10 years, or the early school years. Children who have socialization or academic problems may establish a failure identity. He suggests that human learning is a lifelong process. Therefore, one can change one's identity at any time in one's personal history by learning what needs to be learned. These are the following areas that we will discuss about the reality therapy. Basic philosophy of reality therapy. Humans are self-determining. Next is humans change when they determine their behavior is not getting them what they want, and when they believe that have choices of behavior. People choose total behavior, hence responsible for acting, thinking, feeling, and psychological states. Yes, if I talk about reality, it focuses on that choice. So every one of us has a freedom of choice. So what happened to us, it's because of our choices in life. So if we think that our choices affect our life negatively, so maybe it is good for us to recognize that kind of behavior and help us, or it can help us understand and help us to change ourselves. Behavior is aimed to satisfy needs for survival, love and belonging, power, freedom, and fun. Acting and thinking are chosen behaviors. Changing acting and thinking influences feelings and physiological state. Choice theory explains how people attempt to control their world and teaches ways to satisfy needs and wants in effective manners. The key concepts of the reality therapy is the basic focus is on what clients are doing and how to get them to evaluate whether their present actions are working for them. So, it helps the clients to evaluate their actions and try to think that it is if it is has a good and or negative result in our life. People create their feelings by the choices they make and by what they do. Yes. The approach rejects the medical model, the notion of transference, the unconscious, and dwelling on one's past. Okay? They will not focus on their past or on their unconscious minds. So they will focus on their present, the here and now of the clients. Okay, these are the key terms. The first is autonomy. It is a state of accepting responsibility and taking control of self or our life. So, we have the authority of ourselves. No one's control our life but ourselves. Next is commitment. Not skewing from the plan for change. So, maybe it happens when we want to change certain behavior or a negative behavior of ourselves. So, we must to commit for change. Next is choice theory. Humans are internally motivated and have a purpose to control behaviors. Humans are self-determined and create own destiny. All elements of behavior are interrelated. Next is cycle of counseling. Any means to create a positive environment in counseling based on personal involvement and procedures for change to occur. The next one is the involvement. Counselors' interest in and caring for clients. Yes, we must involve ourselves to have a better result or for a better change. Next is paining behavior. People choose misery by developing symptoms like headache, depression, anxiety, because at the time they seem to be the best behavior to execute for survival. Next is perceived world, the reality we experience and interpret. Psychological needs. Needs for belonging, power, freedom, and fun that drive people and explain behaviors. Quality world. Perceptions and images we have to fulfill our basic psychological needs. Responsibility. Satisfying personal needs while not interfering with people who fulfill their needs. Next is self-evaluation. Client's assessment of current behaviors in order to determine if their behaviors are working and if behaviors are meeting their needs. So self-evaluate. Total behavior. Integrated components of doing, thinking, feeling, and physiology. WDEP systems. It applied to the practice of reality therapy groups. Strategies help clients identify their wants, determine direction behaviors take them. Self-evaluation and designs plan for change. Okay, what are the roles of the counselor? Counselor is a teacher and a model to the client. So we must show them, or the client or the counselor must show to the client what is the correct behavior or what are the things that will help the client to change positively. They create an atmosphere of acceptance and warmth, helping the clients focus on the control of displayed thoughts and actions. Reality counselor use ing verbs to help the clients describing their thoughts and actions like angering, bullying, intimidating, excusing. Focus on the behavior that the client needs or wants to change and how to change that behavior in a positive manner. Reality therapy does not generally use formal assessment techniques or diagnostic categories. The goals of therapy. The overall goal. Assess clients to better meet their needs for love, belonging, survival, power, freedom, and fun. So this is the goal, to gain this kind of needs that they want from others. help clients gain psychological strength, accept personal responsibility, regain control of lives. Challenge client to examine what they are doing, thinking, and feeling. They help the client to develop a practical plan to accomplish their personal needs and desires. They help the client put the past behind and focus on the present and the overcome of present behavior. So, yes, we already talked about that, about the here and now life situation of the client. So we will not focus on the past but the present. And what are the present behavior that they want to change for themselves positively to help people become more effective in meeting their needs, to teach clients to help to self-evaluate behavior and determine what they want to change. The therapeutic relationship are the counselors are involved with clients from outset and create warm, supportive, and challenging relationship. Clients must know that counselors are for them. So, in this part, there is a feeling that they know that the counselor want them to change, or they are always supportive for their life, for their situation, for the change that they want to have in their life. Involvement with and concern for are conveyed throughout the counseling process. So there is a continuation of feelings. So from the first to the last part of the session or the therapy session, there is a consistency of feelings. Feelings that they felt from their counselor. Counselors confront clients with reality and consequences of their actions. Counselors avoid criticism, accepting excuses, and giving up on clients. Assist clients to continually assess effectiveness and appropriateness of their behaviors. What are the techniques of therapy used in reality therapy? So the main techniques has 3 basic steps. Through involvement with the client, the counselor helps the client to see the reality and understand how a behavior is unrealistic. The counselor separates the client from the behavior and rejects the behavior without rejecting the client. The final step is to teach the client how to fulfill their needs realistically and positively. Glacier uses humor to point out absurdity without being sarcastic. He uses confrontation to help the client accept responsibility for behavior. The 8 steps that reality therapy uses to accomplish its goals and techniques are establishing a relationship, focusing on present behavior, client evaluation of his or her behavior, developing a contract or plan of action, getting a commitment from the client, not accepting excuses, allowing responsible consequences but refusing to use punishment, refusing to give up on the client. The Glacier's final technique is never give up. So yes, we must, or the client, or all of us, we never give up in any kind of situation or problem that we may face in our life. It has been applied to youth of offenders, youth that are in the detention facilities. Variety of behavioral problems, individuals and group counseling, and marital and family counseling, military, drug and alcohol clinics, teaching and administration, social work, crisis intervention and management, and community development. The multiculturalism of reality therapy. Its focus is on members making an evaluation of behavior, including how they respond to their culture. Through personal assessment, they can determine the degree to which their needs and wants are being satisfied. They can find a balance between retaining their own ethnic identity and integrating some of the values and practices of the dominant society. This approach stresses taking charge of one's own life, yet some clients hope to change their external environment. Yes, because maybe we know that our external environment can affect our behavior. So we know that there is a thing that we call adaptation. So we adapt in our environment. Next is counselor needs to appreciate the role of discrimination and racism and help clients deal with social and political realities. Respect differences in worldviews and cultural values. Skillful questioning will help assess how ethnic minorities have acculturated. The contribution of reality therapy. It is a short-term approach with wide range of clients. Due to the direct methods, it appeals to many clients who are often seen as resistant to therapy. Simple and clear concepts can be used by parents, teachers, educators, nurses, ministries, managers, consultants, supervisors, counselors, and social workers. Positive, action-oriented approach. Accepting personal responsibility and gaining effective control. People take charge of their lives. Focus for what clients are willing to do in the present. The limitations of this reality therapy is discounts the therapeutic value of exploring the client's past, dreams, the unconscious, early childhood experiences, and transference. The approach is limited to less complex problems. It is a problem-solving therapy that tends to discourage exploration of deeper emotional issues. Direct questioning needs to be softened when working with ethnic minorities. Because it uses confrontation. So direct questioning. But it must not use in every situation. So next is minority clients may be hesitant to state what they need. The last techniques that we will discuss used in guidance counseling is the group therapy. It was introduced by Irvin D. Yalom. These are the following parts of our discussion. Then, an overview of group therapy, principles of group therapy, how it works, effectiveness of group therapy, benefits of group therapy, an overview of group therapy. Group therapy is a form of psychotherapy that involves one or more therapists working with several people at the same time. This type of therapy is widely available at a variety of locations, including private therapeutic practices, hospitals, mental health clinics, and community centers. Example of this is in the hospital. So, group therapy can be used in a patient or a cancer patient. So, each cancer patient, they can gather all together, form a circle, and share his or her own challenges, her or his own life. That maybe that kind of story, it can help others. Group therapy is sometimes used alone, but it is also commonly integrated into a comprehensive treatment plan that also includes individual therapy and medication. Principles of group therapy. In the Theory and Practice of Group Psychotherapy by Irvin D. Yalom outlines the key therapeutic principles that have been derived from self-reports from individuals who have been involved in the group therapy process. The first principle is instills hope. The group contains members at different stages of the treatment process. Seeing people who are coping or recovering gives hope to those at the beginning of the process. Second, universality. Being part of a group of people who have the same experiences helps people see that what they are going through is universal and that they are not alone. Yes, so maybe ito yung times na iisipin ng isang tao na hindi pala ako nag-iisa. Kung kaya niya, kaya ko din. Yan. Imparting information. So, group members can help each other by sharing information. 4 is altruism. Group members can share their strengths and help others in the group, which can boost self-esteem and confidence. Number 5, the corrective recapitulation of the primary family group. The therapy group is much like a family in some ways. Within the group, each member can explore how childhood experiences contributed to personality and behaviors. They can also learn to avoid behaviors that are destructive or unhelpful in real life. Number 6, development of socialization techniques. The group setting is a great place to practice new behaviors. The settings is safe and supportive, allowing group members to experiment without the fear of failure. Number 7, imitative behavior. Individuals can model the behavior of others or of others members of the group or observe and imitate the behavior of the therapist. Okay, in this part, you can learn from the others or your co-patients. So yes, the patient who have the same situation as you are. How they cope, how they manage with their disturbances or their disturbance behavior. So you can learn from them. Okay, number 8, interpersonal learning. By interacting with other people and receiving feedback from the group and the therapist, members of the group can gain a greater understanding of themselves. So yes, interpersonal meaning interacting with the other people. Okay, you're the people who belongs in your group. So try to interact with them. learning from each other, giving feedback, what they think about you, what they notice about you. Number 9 is group cohesiveness. Because the group is united in a common goal, members gain a sense of belonging and acceptance. Number 10, catharsis. Sharing feelings and experiences with a group of people can help relieve pain, guilt, and stress. Number 11, existential factors. While working within a group offers support and guidance, group therapy helps members realize that they are responsible for their own lives, actions, and choices. How it works. Group can be as small as 3 or 4 people, but group therapy sessions often involve around 8 to 12 individuals, although it is possible to have more participants. The group typically meets once or twice each week, or more, for an hour or 2. According to author Audit Manor in the Handbook of Psychotherapy, the minimum numbers of group therapy sessions is usually around 6, but a full year of session is more common. Manor also notes that these meetings may either be open or closed. In open sessions, new participants are welcome to join at any time. In a closed group, only a core group of members are invited to participate. So, what does a typical group therapy session look like? In many cases, the group will meet in a room where the chairs are arranged in a large circle so that each member can see every other person in a group. A session might begin with members of the group introducing themselves and sharing why they are in group therapy. Members might also share their experiences and progress since the last meeting. The precise manner in which the session is conducted depends largely on the goals of the group and the style of the therapist. Some therapists might encourage a more free-form style of dialogue, where each member participates as he or she sees fit. Other therapists, instead, having a specific plan for each session that might include, but having clients practice new skills with other members of the group. The effectiveness of group therapy. Group therapy can be effective for depression. In a study published in 2014, researchers analyzed that happened when individuals with depression receive group cognitive behavioral therapy. They found that 44% of the patients reported significant improvements. The drop rate for group treatment was high. However, as almost 1 in 5 patients quit treatment. An article published in the American Psychological Association Monitor on Psychology suggests that group therapy also meets efficacy standards established by the Society of Clinical Psychology, Division 12 of the APA. It is effective for panic disorder, bipolar disorder, obsessive-compulsive disorder, social phobia, and substance use. The benefits of group therapy. The principal advantages of group therapy include: 1. Group therapy allows people to receive the support and encouragement of the other members of the group. It once happened when people participating in the group can see that others are going through the same thing, which can help them feel less alone. Number 2, group members can serve as role models for other members of the group. By observing someone successfully coping with a problem, other members of the group can see that there is hope for recovery. As each person progresses, they can, in turn, serve as a role model and support figures for others. They can help foster feelings of success and accomplishment. Number 3, group therapy is often very affordable. Instead of focusing on just one client at a time, the therapist can devote his or her time to a much larger group of people. Number 4, group therapy offers a safe haven. The setting allows people to practice behaviors and actions within the safety and security of the group. Number 5, by working in a group, the therapist can see firsthand how each person responds to other people and behaves in social situations. Using this information, the therapist can provide valuable feedback to each client. That would be all my topics about the theories and techniques used in guidance counseling. We tackled all the 9 techniques used in guidance counseling. The first 3 is a part of behavioral approach. The CBT or the cognitive behavioral therapy, the REBT or the rational emotive behavioral therapy, and the transactional analysis or the TA. While in the humanistic approach, it has also 3. First is the person-centered therapy. Next is the Gestalt therapy. And the third one is the existential therapy. Also, we tackled about the others kinds of techniques used in guidance counseling. First is the Adlerian therapy, or also known as the individual therapy. It focuses on the individual and how they interact with the other people or in our society. The second one is the reality therapy, or also known as the choice theory, helping us recognize our own mistakes, our own choice of freedom, or our freedom of choice, and how we are able to change that specific negative behavior that we recognize. And the last one is the group therapy. And that would be all. And I am Michelle Fuerzas, your reporter for this topic. Thank you.